We continue our segment for the children this morning. Today we are discussing gastroenteritis in children. Joining us this morning is Dr. Mark Strassburg. Thank you for coming in today.
Thank you for having me.
What is gastroenteritis?
Gastroenteritis is typically it's a viral infection of the gut. There's a significant border along the gut that helps us absorb things, and when you get this infection, it disrupts that border, and therefore you end up with vomiting and diarrhea. It's very common. We see this in all ages, adults and children, but we see it very typically in our younger kids.
How is it transmitted?
It's transmitted hand-to-mouth transmission. This is why we physicians like to preach hand washing so much, because this is one that you can certainly prevent by washing your hands frequently. A lot of children, when they have diarrhea, certainly they're going to be transmitting viral particles at those times. So very important when you're changing diarrhea, that kind of thing, to make sure and wash your hands frequently. And we certainly recommend this to any daycare provider as well for the same reason.
What concerns should parents have if their child does have gastroenteritis?
Well, typically the main problem that you run into with gastroenteritis is dehydration. The children, basically everything is moving so quickly that they're just not able to hydrate themselves very well. Also with vomiting, it makes it very difficult for a patient to take in fluids. So if you typically have vomiting and diarrhea, that makes it much more difficult. The good thing is most of our patients should be able to rehydrate themselves, so rarely does this have to be something we have to treat in the hospital, but certainly it can be.
What can parents do to treat it if it's not treated at a hospital or at a doctor's office?
Well, there are a few things that you can do. The main thing that you want to do is I always tell my parents to just keep giving them stuff to drink. Even if they're vomiting, if they're taking in fluids, most of that will stay where it's going. So you want to continue to encourage that. There are several different solutions out there that can be used. There's Pedialyte for our younger children. Gatorade works well for our older children. I just recommend staying away from things that are caffeinated. Those can make you a little more dehydrated, actually. Benadryl is actually also a common medicine that most people have at home, which works very well for nausea, and it can be given even in smaller children. It works very well. There are also prescription medicines we can do as well, but we usually save those for our older children.
And what can parents or kids do to prevent getting gastroenteritis?
Well, once again, the best thing to do is just washing hands. And in our small infant set, at 2 months, we can give them a vaccine to prevent rotavirus. That's a very common virus that causes this type of infection, especially in our younger children. We give it at the 2-month visit, the 4-month visit, and the 6-month visit as an oral medicine, and that way they can prevent themselves from getting gastroenteritis. That's had a significant improvement in our number of children that have been hospitalized for this illness.
And how common is this?
Very common. We see it quite frequently, especially in the early fall and winter, and we have several children with this coming in at any given time. I personally see many a day that are doing that have this kind of infection.
What's the length if a child does have it that they get feeling better?
Typically the vomiting is pretty short. Usually that's for about the first 24 hours. Now we do have some children that are going to be a little more prolonged, but diarrhea typically can last about 3 to 5 days, but it certainly may last 2 weeks. But once again, if they're having diarrhea that's lasting greater than 2 weeks, we would like to see them in the office for that.
Great. Thank you so much for coming by today.
Thank you very much.
And if you have any questions for the Children, email us. We'd love to hear from you. It's morning@WTVY.com. And remember, you can watch this and past interviews on our web channel, WTVY.com. Just click on For the Children.
I've got a final look at your forecast when we come back. Plus, Mr. Food's making pot roast cacciatore. And don't forget, Gina and